Precision Dynamics TimeMed has been the leader in laboratory information system labeling for over 50 years. Our V-notch secondary labels for blood collection tubes present a simple solution for accurate identification, instrument optimization, and patient safety.
Blood collection tube identification scenario. Do these blood collection tubes with misaligned labels look like a familiar sight? Using standard labels is problematic. When labels are applied incorrectly, it's often impossible to scan the barcode. This can greatly limit efficiency in the lab. Misaligned labels can also cause readability errors with analyzers or other test equipment. Relabeling blood collection tubes can create extra work and reduce efficiency in the lab, costing the hospital time and money. Poorly identified blood collection tubes may also necessitate redrawing the sample from the patient. This may affect patient satisfaction scores. Think about the implications of time, extra work, and preventable additional expenses that could result from misaligned labels on blood collection tubes.
And even more important than the extra time and money is the risk of a patient identification error. Just one misaligned blood collection tube label can lead to a serious error. If a patient receives incorrect test results, unnecessary treatment, surgery, and patient stress are just a few potential serious consequences. These events also present unnecessary costs, work, and risk of liability to the hospital.
The solution: V-notch secondary labels from Precision Dynamics TimeMed.
V-notch secondary labels from Precision Dynamics TimeMed, along with BD Vacutainer plus plastic tubes, allow for correct label placement the very first time and every time. We've partnered with Becton Dickinson, the largest blood collection tube manufacturer in the world, to commercialize this patented technology.
The V-notch secondary label used with BD Vacutainer plus plastic tubes provides these benefits: consistent and easy labeling guides, accurate and reliable barcode scanning, helps prevent test result delays caused by misaligned labels, helps improve patient safety.
Overall, your hospital can save time and money while improving patient safety and satisfaction.
How to apply the V-notch label. There are 3 easy steps to ensure accurate labeling for the laboratory. Step 1. Peel the printed V-notch secondary label from the liner. Step 2. Visually align the V-notch in the V-notch secondary label with the color-coded notch on the BD Vacutainer Plus plastic tube. Step 3. Before you apply the V-notch secondary label, make sure the color-coded notch and the color-coded sidebar on the BD Vacutainer Plus plastic tube are clearly visible. This allows the medtech to be able to identify sample type after the stopper is removed. Smoothly wrap the label around the tube. Once the V-notch secondary label is fully adhered to the BD Vacutainer Plus plastic tube, the color-coded notch and the color-coded sidebar should be clearly visible. How does the specific placement of the V-notch secondary label help you?
For the nurse and phlebotomist, anyone labeling tubes at bedside, V-notch secondary labels assist with consistent and easy labeling guides, ability to view the sample to ensure proper fill, preventing test result delays caused by misaligned labels, preventing redraws due to misaligned labels or misidentified blood collection tubes. For the lab technician, V-notch secondary labels assist with consistent barcode readability with laboratory instruments, ability to identify tube type if the cap is removed, ability to view sample quality and proper fill level. For the lab manager, V-notch secondary labels assist with reducing downtime and improving lab workflow and productivity. Fewer labels used equals money saved. Helps prevent patient ID errors.
Now that you've seen V-notch in action, here are just a few success stories from laboratory directors about this revolutionary product.
After switching to V-notch labels, we increased the number of lab results by 290,000 over 3 years. That's a 14% increase in productivity. On top of that, we also reduced test tube label costs by 6%. V-notch helped us reduce costs, increase efficiency, and maintain our focus on patient safety and quality care.
Prior to using V-notch labels, our staff was forced to relabel more than 90% of our test tubes. Now that we're using V-notch labels, we're relabeling fewer than 10%, Plus, we're experiencing significant time and cost savings.
Join the many hospitals that have already made the move to V-notch secondary labels for accurate labeling and identification of blood collection tubes on the very first try. See for yourself how this simple product can help reduce costs, increase productivity, and most importantly, improve patient safety.
For more information about V-notch secondary labels, contact us today at 800-323-4840 or visit us online at www.pdcorp.com/vnotch.